Hello, my name is Stephanie Gage, and I'm in the FNP program here at Arkansas State University. My research project is comparing the efficacy of intra-articular leukocyte-rich to leukocyte-poor platelet-rich plasma injections to intra-articular corticosteroid injections in treating knee osteoarthritis. I would like to take a moment to thank my faculty mentor, Dr. Chris Jordan, and my clinical instructor, Dr. Nancy Baltz, for their assistance with this research project. Here I've included my Create AState research poster. In the following slides, I will go through each section in more detail. In 2019, the Centers for Disease Control and Prevention estimated that over 30 million adults in the U.S. have been diagnosed with knee osteoarthritis. This is a map from the CDC showing that in 2015, Arkansas was listed as one of the top 15 states for adults being diagnosed with knee osteoarthritis, with 34 to 46% of the state's population being affected. Knee osteoarthritis is a chronic, progressive degeneration of articular cartilage leading to joint space narrowing, thereby producing pain, limited range of motion, and stiffness, which negatively impacts patients' functional abilities and quality of life. This illustration shows a normal knee joint here on the left. You can see adequate joint space, and the articular cartilage is nice and smooth. On the right is what an arthritic knee might look like. You can see joint space narrowing and cartilage loss, and several areas of bone spur formation. So you can see why patients with knee osteoarthritis have problems really doing any activities. Intra-articular corticosteroid injections have long been a standard treatment for knee osteoarthritis. However, their often and prolonged use has been shown to progress cartilage deterioration. Recently, a new treatment option has been introduced, platelet-rich plasma or PRP intra-articular injections. There are currently two subtypes of PRP, either leukocyte-rich or leukocyte-poor. However, it remains unclear which is more effective in reducing osteoarthritis symptoms. The purpose of this study is to determine which PRP injection is more effective in pain reduction for the treatment of knee osteoarthritis when compared to corticosteroid. The primary objective of the study is to determine which PRP injection is more effective at reducing pain caused by knee osteoarthritis when compared to intra-articular corticosteroid injection. If we reveal which PRP is more effective at reducing knee pain, we can then compare the efficacy to corticosteroid injections to determine if PRP would be a safer, more effective treatment option. The charts reviewed in this study included both male and female patients with ICD-10 codes of M17.11 or M17.12 who were between the ages of 40 and 60 years old with commercial health insurance and visited the clinic between the dates of November 1st, 2018 to November 1st, 2019 and received either leukocyte-rich or leukocyte-poor PRP or corticosteroid knee injections. Exclusion criteria included those under the age of 40 and over the age of 60 without commercial health insurance and lacking the ICD-10 codes of M17.11 or M17.12. A total of 30 patients were included in this retrospective chart review. You can see in the leukocyte-rich PRP group, there were 10 patients, all of which were male. In the leukocyte-poor PRP group, there were 4 patients, 2 male and 2 female. And in the corticosteroid group, there were 16 patients, 6 male and 10 female. This descriptive study was conducted at a local Arkansas orthopedic clinic through a retrospective chart review of 30 electronic medical records. Simple mathematical calculations were utilized to determine which type of PRP injection was more effective at improving knee osteoarthritis symptoms when compared to corticosteroid knee injection. This graph demonstrates the breakdown of the degree of osteoarthritis our patients were diagnosed with. As you can see, the majority of our patients were diagnosed with severe knee osteoarthritis. 10 patients were diagnosed with mild osteoarthritis, and only 3 patients were diagnosed with moderate osteoarthritis. This study found that leukocyte-poor PRP injections appeared to obtain better pain relief than leukocyte-rich PRP injections, having a 100% success rate. As you can see from the chart, corticosteroid injections also had a 100% success rate in relieving knee pain. Of those that received leukocyte-rich PRP, 70% achieved pain relief, while the other 30% did not and subsequently underwent joint replacement surgery. An interesting note, age did not seem to be a contributing factor in determining the amount of relief obtained from either PRP or corticosteroid injection, as the patients that resulted in joint replacement were 48, 50, and 53 years old, all of which had severe knee osteoarthritis. The number of adults dealing with knee osteoarthritis is substantial, putting significant pressure on our healthcare system. It is estimated that $140 billion is spent each year on direct medical costs related to knee osteoarthritis. Numerous research studies have proven PRP injections to be a safer option when compared to corticosteroid, as the product of PRP is autologous and causes no adverse effects, whereas repeated corticosteroid injections within a 3-month period can lead to progressive cartilage degeneration. In efforts to find safe, successful, and cost-effective treatment options for knee osteoarthritis, this chart review found leukocyte-poor PRP injections to be as effective at relieving osteoarthritis-associated joint pain as corticosteroid injections. I recommend further research into comparing the efficacy of PRP injections in the treatment of knee osteoarthritis, preferably with a larger sample population to obtain more accurate results. Here are just a few references from my research project. If you would like a full list of my references, those are available upon request.